Hi, I'm Brett Dyer. I'm a periodontist in Sugar Land, Texas. And today we're talking about gum recession. I think that's a topic that's on a lot of people's mind, and it's kind of easy to identify. Just like this first photo that you see right here shows. Um, just by lifting up our lips and looking in the mirror, we can determine whether or not we've got some kind of gum recession somewhere. The teeth look longer than they used to. Other signs and symptoms are maybe you're eating dinner and you're getting food caught in between your teeth. All those are signs of gum recession. I'm going to switch over to my slideshow. So today we're going to talk about all things gum recession, how to identify the recession, what causes it, how to correct it, and how to prevent it from coming back. I think those are things that we think about, and they're easier to identify than we think. It's just, I think we get all wrapped up in the idea of gum recession. So in the chat box to the right, if you would, if you have any questions about gum recession or any other dental topic today, or anything that you want me to cover in the future, please, if you'll write that in, and I'll do my best to respond to it and address it one way or the other. So let's kind of jump into what we're going to do. We're going to start off with talking about the causes of gum recession today and how to prevent it from getting any worse, and then how to correct it if we need to correct it. This is my staff. And I want to tell you that we are a team effort in this practice. We could not accomplish anything without all of us working together. And I'm so thrilled and excited to get to work with this group of people. And let me tell you a little bit about the history of treating gum disease from a periodontal standpoint, from a surgery standpoint. Originally, in the 70s, we would actually make incisions in the roof of the mouth and harvest tissue from the roof of the mouth, and then create a surgical bed in front of the teeth with the recession, and then place this graft right on top of it and suture it in place. And then, I guess in about 1986, there was a doctor out of New York named Burton Langer. And Dr. Langer is the one who started, instead of just cutting a big square patch like when you're quilting or something out of the roof of the mouth, he would actually fillet tissue out from the inside of the mouth, from the roof of the mouth, and place that filleted tissue somewhere underneath the gum to correct recession. And that was actually the gold standard for the longest amount of time. The reason other methods kept coming up, or other people kept trying, was because there's what we call a lot of morbidity with those old techniques. Morbidity in that it hurt to take a graft from the roof of the mouth. Morbidity in that the damage to the roof of the mouth sometimes meant bleeding, bruising, loss of nerve function to the roof of the mouth. Some impacts on taste. There were lots of bad things that could associated with that surgery, as well as good. And then in the I guess around 2002, 2003, a doctor out of Dallas started developing a tunnel technique, and we'd actually make a little incision and slide grafts through a tunnel. And we were using all sorts of different types of grafts, trying to cover up recession. And what we're doing today, this pinhole technique, is really kind of the tunnel 2.0 approach of grafting. It's unique in that it's minimally invasive, more minimally invasive than anything that we've ever done. And so what's that mean for a patient? Minimally invasive means that you heal so much faster from this type of procedure than you would a traditional surgery. Minimally invasive means there's less swelling and less pain. Typically, patients take Advil after these surgeries. They don't need a lot of pain medication. Sometimes it feels swollen, but that's because we're putting grafts underneath the gum. And so it makes the gums feel a little bit thicker. But with a minimally invasive, faster healing surgery, it's a lot. It's another type of process altogether. The pinholes that we used during the surgery to do this type of grafting, there's many days, the next day after surgery, you can't see the pinhole anymore. It heals that fast. So it's a brand new approach, something to think about in the event that you ever need correction. Let's talk about what causes gum recession. And one of the main things is that the teeth are surrounded by gum tissue that's really thin, or it has really thin bone. You see this a lot in patients who are undergoing orthodontics. Sometimes the jawbone isn't big enough for all the teeth. And so as your teeth get evened out and spread around in your smile, it pushes the gums and the bone, and it makes them too thin. Or sometimes you just don't have enough bone genetically. And so when you go through orthodontics, not only does the teeth move outside the bone a little bit, but it starts pushing on the gum tissue, and maybe the gum tissue is thin too. So genetics plays a big role. The size of your jaw, the thickness of your gum. You know, the average thickness of gingival tissue is just 2 millimeters for most people, and so that's not really thick. Other things that can lead to recession: clenching and grinding. A good way to tell if you're a lot of patients tell me, I don't think I clench, or I don't think I grind. And I'll look at their teeth and I'll go, but your teeth are flat and they used to be pointy. Oh, that must have happened a long time ago. I don't think I do it anymore. I hear that a lot. And then I say, okay, well, test yourself during the day. And an easy way to test yourself is every hour on the hour, just ask yourself, are my teeth touching? At rest, your teeth should be separated by just a millimeter or two. If they're not separated by a millimeter or two, you're clenching. The only time your teeth really come together during the course of a day is when you're eating. And then the rest of the time, your teeth should be a little bit separated, just a little bit, just a hair's width, a millimeter or two. But clenchers tend to clench all day. I know this because I'm a clencher too. I can tell you that when I'm concentrating, I'm clenching. And I catch myself doing it all day long, even though I know the consequences of clenching can be recession and cracking your teeth and other things like that. Another common cause of gum recession is brushing too hard. Sometimes we think the right thing to do is to scrub really hard when we're brushing. So we'll put the toothbrush in the palm of our hand and we'll really go to work at it, trying to clean our teeth. But the truth is that the best way to brush your teeth is holding your toothbrush in the tips of your fingers, not in your palm, and to brush lightly with a really soft brush. Medium and hard brushes actually don't clean in between the teeth very well because the bristles don't bend well. And so as you're trying to push in between and clean in between the teeth, they just don't go. And so you press harder, and that can lead to gum recession. Gum infections. When you're before age of 40, you don't really see a whole lot of patients with gum disease unless they have a genetic predisposition for the disease, which happens. Gum disease runs in families, no two ways about it. But after age 40, we start to see a growing trend of more gum disease. And that's because when you were born, 15 minutes after you were born, you had a bacterial flora in your mouth already. And that flora from that time on, all the way up until your 40s, is protective in nature, really. Your bacteria coats the inside of your mouth, and when foreign bacteria try to get into your mouth, they don't have anywhere to land because your bacteria are covering everything. Or if they do manage to land, they don't have anything to eat because your bacteria are eating everything. But sometimes over time, your bacteria can start to become pathogenic, and they can start creating an environment in which bad bacteria, pathogenic bacteria, can live. And then you get these infections in your gums, and you get gum disease. And with gum disease, you lose the bone around your teeth and your gums recede. That's all part of it. And other aspects are bad habits, whether it's biting and pinching at your teeth. I see some people that scrape on their teeth with their nails. Other bad habits are things that we don't think about would cause gum problems, like smoking. Cigarette smoke leaves tar on your teeth. The tar on your teeth, your gums don't like it, so they recede away from it. Vaping, surprisingly enough, marijuana has been legal in Colorado now for quite some time, and the University of Colorado at Denver has been conducting studies on patients who vape and smoke marijuana and things like that for years now. And so smoking marijuana has basically the same effect as smoking cigarettes on your teeth. And vaping, oddly enough, I wouldn't have guessed this, but vaping is actually really hard on your gums. whether you're vaping nicotine or you're vaping THC or whatever it is, all those types of products are causing gum recessions in patients and in younger patients, because a lot of younger people are vaping. This first slide that you see is just thin gum. So this patient's already an ortho, so they have braces on their teeth. And notice that the teeth, they're trying to close the gaps between the teeth, but the gum's already thin in front of those teeth, and you can already see the roots. And even though in the next photo they close the gaps, the recession remains. And so just having thin gums, thin gingiva, and this especially comes out when you're going through ortho, can lead to this type of problem. Now, this is kind of a hard one to look at. I hope you're not eating while you're watching this, but this was actually a surgical view of patients with thin bone. And so what you're looking at is the gums have been pulled back, and you're looking at the roots of the teeth and the bone that covers them. And the bone's supposed to cover over these roots smoothly. You're not supposed to be able to see the roots at all, but you can see there's like windows, we call them dehiscences, over all these roots. And that's what people's bone look like when it's really thin over the roots. So that can lead to gum recession just because there's no support for the soft tissue underneath. These are effects of teeth grinding. So if you look on the one side of the screen, you can see the drawing on there. And an abfraction is when you take your nail and you feel along the sides of your teeth and you feel a notch. That notch is called an abfraction. What you're doing is you're clenching and grinding on the teeth so hard that you're causing the teeth to flex. And at the flexure point, the teeth chip out, because teeth are crystalline in nature. And so when you're clenching and grinding and you do it hard enough to make your teeth do the hula, the enamel at the neck of the tooth breaks off and you get these notches. So you can test that on yourself. Put your fingers on your teeth and grind left and right, straight back and forth. If you feel your teeth flexing or vibrating, you're causing your teeth to bend a little bit. Now take your fingernails and rub down the neck of your tooth. And if you've got a notch at the neck of the tooth, that's an abfraction. That leads to gum recession. The gum's unstable where the tooth bends, and so it recedes from that bending point. And then another aspect of clenching and grinding is it can flatten the teeth. So look in the mirror and see if all your teeth are supposed to have grooves and ridges. And even your front teeth have grooves and ridges. But in clenchers and grinders, the teeth all tend to be really flat. Or you see flat spots all over the teeth. That's from clenching and grinding. Even if you don't think you're doing it, you're doing it. Other things that clenching and grinding can cause commonly, say that the teeth aren't bending. Your gums and your bone are strong enough that they're holding it in place, and so the teeth break instead. So look in the mirror really closely, maybe with a flashlight, and see if you see little lines going down the lengths of your teeth. Those are called craze lines. Those are shallow cracks in the enamel. And over time, a crack can expand. Just like a crack in a windshield gets bigger over time, cracks in your teeth can get bigger over time too. So check that out in the mirror and see if you see any of these types of things. This just shows different types of cracked teeth. Now, the natural photo on the side of your screen is showing you all sorts of stuff. You've got advanced recession, you've got these abfractions, these notches, and then as the gums have receded, the dentin of the teeth is soft. The cementum and dentin, the covering of the root, it's soft, and so the acids from your saliva can actually cause it to melt away. And so not only do you have notches, but now you're starting to melt away the surface of your root, and you start seeing these discolorations in the root. If you're clenching and grinding so hard that you're chipping and cracking your teeth, there's different types of cracks that occur too. I place hundreds of implants every year because patients fracture their teeth. They grind so hard that the teeth split vertically or at an angle, or they chip, and they do it in such the extent that the tooth dies. And so clenching and grinding has lots of consequences. Toothbrush abrasion, we mentioned that at the beginning. So just remember, when you're brushing your teeth, don't palm that toothbrush. Hold it in the tips of your fingers and brush lightly with a soft brush. It actually cleans in between the teeth better, and you're less likely to abrade your teeth and cause gum recession. Also, don't use the most abrasive toothpaste. Because they've taken some of the toothpaste off the market that were for smokers because they were so abrasive, you were literally brushing away your teeth in a year or two. So I like to stick with the least abrasive toothpaste that I can get. The kinds that we recommend are all less abrasive. Consumer Reports did a good article on the abrasivity of toothpaste, and you can look that up online if you want. But just I will tell you that we recommend to our patients, I recommend Colgate all the time. Colgate is kind of a middle of the road or on the low end of abrasivity. So is AIM for that matter. And so those are the two most common that we tend to recommend. This diagram, it shows you the masticatory system just means clenching your teeth. And so when you clench your teeth, there's basically three effects it can have, or three directions that the force can impact. One's your teeth. And so if you're clenching hard enough, you can cause your teeth to crack and your enamel to abrade away. And your bite, if you're clenching enough, you can actually cause your muscles, your brain will try to adapt to this clenching and grinding that you're doing, and it will transfer some of that force to other parts of your jaw. So you can start to develop a tender TMJ. So if you touch right over your joint, your TMJ muscle, or this joint in your either side of your jaw, and press on it and it's tender, most of the time that's from clenching and grinding. And most of the time that has to do with something off in your bite. And so not only can clenching and grinding cause gum recession, it can cause TMJ, it can cause cracks and breaks. It can cause splinting of your muscles. And by splinting, what I mean is think of a Charlie horse. So if you're clenching and grinding enough, sometimes the muscle spasms. And then you can touch these muscles on the sides of your face and they feel like knots. And those knots are muscles that are spasmed. And then lastly, if you have early gum disease and you clench and grind your teeth, that little movement of your teeth can cause your teeth to push around the bone, just like sticking a stick in the ground and swirling it. That makes the ground push away from the stick. Well, that can happen from clenching and grinding too, allowing your gum disease to progress faster than it would normally. This is a diagram of what we use to adjust someone's bite. So I place these computer sensors in someone's mouth and I have them bite on it, and it makes a video of their bite. Let's see if I can play some or give you an idea what that looks like. So this is having someone clench on their teeth, and then I'm going to have them move from side to side. And with this type of technology, I can see how hard their teeth are hitting and where on their teeth they're hitting. So you see I'm having them move from side to side, and you see these big bars come up, and that's just showing me where the concentration of the force of their bite is. And we can adjust that to reduce these high points in the teeth that cause fracture and breaks. So this is a patient who's just had or finished their orthodontics, and they started to develop this recession between their teeth. And part of it was because they were clenching and grinding their teeth. Look at the edges of their teeth. You see those flat edges on their incisal edges? So we did a bite adjustment and noticed that their gum tissue grew back in between their teeth just after doing the bite. Well, it took about 2 to 3 months for their gum tissue to grow back. But it did grow back just by making it where they weren't grinding their teeth anymore. So let's talk about if you do have gum recession, what are alternatives? What are the techniques to repair it today? One, you have to address the cause. So before we do any type of correction, we have to say, okay, so what led to this gum disease? Was it toothbrush abrasion? Was it thin gingiva, thin bone? Was it clenching and grinding? And whatever the cause was, we need to address that first. And there's different ways to address all of them. Like I said, if it was clenching and grinding, a lot of times it's adjusting someone's bite. Or maybe it's when you're focused, like when I get focused, I tend to clench. Maybe you need some Botox in your muscles that you clench with. We do that quite frequently too. Makes those muscles relax, and we can adjust their bite to what we call a relaxed muscular position. But whatever the cause of the recession is, we have to address that first. If the bone is too thin around the teeth, we need to do something to thicken that up when we repair the recession. So this is, I lecture many times during the year, and this is one of my lecture slides about biotypes. And biotype just means the thickness of your gums. So most people have a moderate biotype, and that means your gums are only 2 millimeters thick. But some people have a thin biotype. You can actually see through their gum and see the roots of their teeth. That's a thin biotype. But most people, on average, have about a 2 millimeter thickness, and you can't see the roots of the teeth. This is a type of recession that we managed with something called a double papilla flap, or double pedicle flap. And basically what I did, you can see where I drew in on this picture. I'm just going to take the papilla and I'm going to rotate them over the recession. I like that technique. It's quick, it's easy, and it gives you a really nice result. There's an immediate post-op after that surgery. So it just covers the recession and it looks good. Other types of grafting around teeth are using what we talked about at the very beginning, harvesting tissue from the roof of the mouth. We don't do a lot of that anymore, but that was the gold standard for many, many years. And today we're using growth factors, and we're using collagen. Just like when patients have their lips plumped up, there's all sorts of collagen preparations that we can use over teeth. And what happens, it's like this tissue up here called fibroguide. It's like a sponge. Think of a kitchen sponge that you'd clean dishes with. I can take this sponge and slide this underneath your gum, and it's made out of collagen. So what happens is your tissue grows through that sponge, and the sponge dissolves because it's made out of collagen, and you're left with your own tissue in that area where your recession was. Tunnel grafting is what we talked about earlier. Amniotic site. So we use growth factors from the amniotic membrane. So when a baby's born via C-section, there is a company that will take the bag that grew that baby and harvest the growth factors out of that bag. We can use those same growth factors to grow your gum and your bone back. And so there's lots of materials on the market today to manage just that. This is a patient who had not only gum recession, but they had bone loss from gum disease around their teeth. And so as you look at this photo, you can see that they've got gum recession. And what you don't see is when I probe around their teeth, they have holes in their bone from where the infection has literally eaten the bone up around their teeth. So in a case like that, what we do is we clean up the infection. And I'm using a instrumentation here and a laser on the bottom. And then we use a combination of techniques. So this is the collagen material that I'm using right now. You see me cutting it up into strips, and I'm going to place that underneath the gum, and then I'm going to add growth factors in bone. And the advantage of that is I repaired this patient's recession and their bone loss all at the same time. So patients with gum disease, typically the most common surgery today is called osseous surgery, and it actually makes your teeth look longer. So this patient, if he had had osseous surgery, he would have had longer teeth after the surgery. With this approach, I can bring the gums up, reduce his recession, repair his bone loss, all at the same time. Another case of the same type of thing. In this particular patient, you can see on the bottom teeth on either side, they had cavities in their roots because the roots were exposed to the oral cavity. Excuse me, I got to get a sip here. But they had their saliva is acidic. Everybody's is. And so it started to eat away the roots of their teeth. So we removed the decay, repaired the bone loss, brought the gums up in one fell swoop. This is a situation where sometimes the margins from restorations are kind of bulky and kind of thick. And you can tell this if you can rub your fingernails across your crowns and they feel kind of thick on the edge. Sometimes the gums will run away from a thick edge. So what we would do in a case like that is we'll thin out the margins so that they're feathery thin and that they blend into the root surface smooth. So if you rub a sharp tip instrument across them, you can't feel them. It's just smooth again. And then I bring the gums down on top of that. So we repair the recession by smoothing the restorations. So that covered a whole lot of material. I'm about to open it up for questions. If you have any, please type in anything you want into the chat box, and I'll address that. Also, you can always email me, and I'll answer your questions. My email is at fortbendperio@gmail.com. And oh, by the way, a replay of this will be available to everyone who registered on this for this event. Let me exit out of this. So I hope that helped you, that you got some ideas of things that were available and how to identify recession. If you have questions about this, please don't hesitate to email us at fortbendperio@gmail.com. You can call us. You can write in the chat box if you want, and I'll address them. Thank you so much for your attention today. And we'll do this again. And just a little over a month from now, we'll be addressing the next topic that we'll address is going to be implants. And so if you're missing teeth and you'd like to know more about that, please watch for our next webinar. Thank you much. Appreciate it.